warahmatullahi wabarakatuh. And today our group number 2 gonna present about cognitive theory. So let's start.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Ashraf and I will present about the history of the theory. But before that, I will briefly explain about cognitive theory. Cognitive theory is a study that examines human behavior through thought processes, proposing that the foundation of behavior and emotion is looking. Now, on to the history of the theory. The emergence of cognitive theory into the scientific field was in the mid-18th century. Carl Wernicke and Paul Bohr were significant with the emergence. Computer science advancement has encouraged comparisons between computer and human cognitive process. Herbert Simon and Alan Newell collaborated with psychologists in cognitive psychology to explore AI significance. AI envisioned numerous mental functions compared to computer operations, including information processing, data storage, and memory. Noam Chomsky, in 1959, critic of behavioral psychology, launched the cognitive theory revolution. Ulrich Neisser was the first to use the term cognitive psychology. His definition of cognition is it underlines the transformation, reduction, elaboration, storage, recovery, and use of sensory. That's all from me. I will pass it to the next presenter.
Hi, my name is Mohammad Aziz, and I'm going to present the next slide, which is theoretical assumption, the premise on which theory is based off. One of the theory that we have researched are social cognitive theory and behavior cognitive theory. Social cognitive theory are theory where it incorporates social interaction and observation into the cognitive framework. The key components of social cognitive theory are related to individual behavior change, and one of them is self-efficacy, or the belief that an individual is able to control and execute their behavior. Other than that is behavior capability, is understanding and having the skill to perform their behavior. Expectation is determining the outcomes of behavior change, while self-control is regulating and monitoring individual change. Observational learning is watching and observing the outcomes of other desired behavior, and lastly is reinforcement, is promoting incentive and rewards that encourage behavior change. For the next slide is cognitive behavior theory that indicates that people's mind, thoughts, behavior, and body sensation are linked toward each other, and whatever people do and think can affect how they will feel. Additionally, change in one of these points can cause change to other individuals, like how they will feel and behave or the thought of their minds. Like for example, when an individual has a negative feelings such as distress or worry, they can fall into a thinking pattern and emotional response that can make any negative feeling even worse. Thus, this theory outlines how individual mental process such as positive and negative emotion, thought, behavior, and body sensation play a big role in the development of individual emotional states. Thank you.
Assalamualaikum, my name is Muhammad Izzat bin Muhammad Idrus, and I will present about techniques and skills in cognitive theory. In cognitive theory, there are techniques and skills used to understand how individuals process information and construct meaning. For my part, I will talk about 3 techniques. First, cognitive restructuring. It's a cornerstone technique that involves identifying and challenging irrational beliefs, replacing them with a more balanced way of thinking. An example would be, imagine a situation where you see your friend have gone out without you. The initial thought is that your friends don't like you, so you would immediately feel sad and lonely. But in reality, they actually thought you were busy and they were afraid to ask you. Next, thought records. It's a crucial technique in cognitive theory, designed to help individuals identify and replace irrational beliefs. However, this involves systematically recording specific situations. The automatic thoughts that arise, associated emotions, and any resulting behaviors or physical sensations. This structured process enables individuals to gain insight into their underlying beliefs and recognize any cognitive distortions at play. By examining and reframing these thoughts, individuals can develop more balanced and constructive ways of thinking, leading to improved emotional well-being and more constructive responses to challenging situations. This shows that thought records serve as a powerful instrument for promoting positive cognitive change and enhancing overall mental health. Finally, role reversals. It's a vital technique in cognitive theory, facilitating a deeper understanding of one's belief and perspectives. This process involves adopting the viewpoint of another person to gain fresh insights into a situation. By stepping into someone else's shoes, individuals can objectively evaluate their beliefs and behaviors. Clients are encouraged to view a situation from a different perspective, often by imagining how someone else might interpret the same events. In conclusion, the techniques and skills employed in cognitive theory provide individuals with a powerful toolkit for understanding and improving their mental well-being. By incorporating these techniques into therapeutic interventions and daily life, individuals can foster resilience, emotional well-being, and a more adaptive approach to life's challenges. In doing so, cognitive theory continues to play a vital role in enhancing the quality of mental health care and promoting personal growth and development. Thank you.
Assalamualaikum, my name is Muhammad Akil and I'm going to present about the first case, which is about forgetting. Before that, I'm going to talk about the interference theory, which is about a phenomenon of forgetting memory as the other memory interface with or disrupt one another. In simple terms, according to interference theory, it means forgetting happens because of the disruption of other memories. The two parts of the interference theory are proactive interference, the inability to learn a new task because of an old task, and retroactive interference, the inability to recall an old task because of a new task. When you learn a new task, you may forget a previously learned task. This is known as retroactive interference. In other words, later learning interference with previous learning by disrupting old memories. In the extra experimental sources of interference in forgetting by Leo Postman in 1960, there are two groups, which were the experimental group and the control group. Both were presented with the same list of parables. However, the experimental group had to learn another list of words. The given mission was that both groups need to recall the initial list. The result is the control group was able to recall the first list more accurately, while the clients or the experimental group had difficulties with remembering the first list of words. This is because the new information disrupts the already existing old information. This occurrence is called retroactive interference. There are several ways to solve the problem presented by the clients or the subject. First one is spaced repetition, which is a technique for revisiting content at regular intervals. So basically, for example, you need to remember the words and you have practice. For each practice, you need to increase the gaps or widen the moment, so like 1 minute, 2 minutes, and you can enhance your memory process. The second way is distinctive encoding. This method involving the subject associating the information that needs to remember, such as mental image, sound, or story, to prevent interference from older or new information, so the information that needs to be remembered will be more distinguishable. Finally, the client can apply context visualization. This method is mainly about associating information with a more specific context, such as environment, situation, favorite person in the room, or information. That's all from me. Thank you.
Assalamualaikum, my name is Sofena binti Ramli and I'll be talking about the next client case, which is postpartum depression. Postpartum depression, PPD, is a medical condition faced mostly by women, though it is not exclusive to them. It causes clients to have these depressing thoughts and anxiety issues. It occurs after childbirth, although it can appear at any point in the first year following childbirth. Although the exact causes of postpartum depression are not entirely understood, it is a mix of hormonal, emotional, and psychological variables. Some symptoms may include difficulty bonding with the baby, anxiety, fatigue, and in extreme cases, thoughts of self-harm and/or harming the baby. Postpartum obsessive compulsive disorder is a kind of postpartum anxiety faced by clients suffering from PPD. It causes unpleasant and obtrusive ideas or visions, which includes thoughts about something tragic happening to them, their child, and their loved ones. Cognitive behavioral therapy is a very effective treatment for postpartum depression and anxiety. The treatment focuses on identifying the underlying issues, such as harmful or ill-natured thoughts and feelings which causes undesired behavior. The treatment includes assisting the mother in understanding and overcoming the issues. Mothers with PPD will learn to identify their thought patterns, which is the first step in addressing them. Then the mothers will learn to replace the negative thoughts with more positive and realistic ones. This leads to improvement in their behavior towards themselves and their baby. Second, the counselor or therapist will help them engage in activities that can improve their mood and well-being, such as small exercises, social interaction, or seeking additional help for the care of the baby and household chores. CBT focuses on a person's thoughts and behaviors and how those two are interrelated with one another. By understanding the causes and effects of a client's thoughts, we're able to modify their behavior in the safety of their family. That's all from me. Thank you.
Hi, my name is Izika, and for my part, I would like you to think about the human mind as a blank piece of canvas. As you can see, us as normal people will have a mind like this, with each of the colors representing a thing which does not interfere with each other innately. However, for some people, their mind would be like this. Just like the colors would splatter around the whole canvas, therefore creating a cognitive world war in their minds. The people with this kind of minds are known to have ADHD, the acronym to the phrase Attention Deficit Hyperactivity Disorder. This mental problem often ties with symptoms like concentration problems, inability to focus, and also constant fidgeting. It is a common problem among people from all ages, which its occurring origin is still not known to us. This disease, however, can be treated in many ways. First and foremost, CBT. It can be used to minimize or even eliminate the symptoms of ADHD. It is done by tackling the client's bad behaviors and from there try to make them adopt new and good behaviors. One of the ways to help them is setting time limits for them to concentrate or focus on one thing. Next, meditation would be a nice way to cope with ADHD too. As meditation focuses on breathing and emphasizes one's mental clarity and peacefulness, it can help with the client to be focused. The normal way is to just sit still and close your eyes to cleanse your mind. However, it can be improved by going to places without a chaotic setting, such as waterfalls or mountains, or even shrines to meditate. Psychoeducation is also a good way to eliminate ADHD. This method helps the client by telling them about what ADHD is in detail and also those around him. This is done for them to realize what the client is going through and also educate them on how to correctly handle and communicate with the client so that they too can help in making the client feel better.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Danish and I'm going to present criticism of cognitive theory. Right. So, mental processes are the inner workings of the mind that are not directly observable from the outside, but they must be inferred based on our observation of human behavior and condition. They involve processes such as perception, attention, memory, and thinking, all of which are fundamental to how humans process and make sense of their environment. The focus on mental processes in cognitive theory has several advantages. First, it allows us to understand how the mind works and how it processes information in different situations. Second, it provides a systematic framework for studying human behavior and cognition, which can be used to develop more effective ways of learning and problem solving. Third, it helps to explain why individuals behave differently in different situations by highlighting the role of mental process in shaping human behavior. For example, cognitive theory explains the role of perception in shaping human behavior by highlighting the ways in which humans interpret and make sense of their environment based on their prior experiences and beliefs. It also explains the role of attention in helping individuals to select and focus on relevance from their environment, and the role of memory in helping individuals to store their retrieve relevant information from their past experiences. Overall, the emphasis on mental processes in cognitive theory has been instrumental in helping us to better understand how humans process and make sense of their environment, and how we can use this knowledge to develop more effective ways of learning and problem solving. Alright, now let's talk about the criticism of cognitive theory. One of the primary criticisms of the cognitive theory is that it lacks sufficient empirical support, particularly in the realm of human behavior and cognition. While some researchers have argued that the cognitive theory offers a useful framework for understanding human behavior, they are concerned that the theory has not been adequately supported by empirical evidence. For example, there have been numerous studies that have attempted to replicate the key findings of cognitive theory but have failed to do so. Furthermore, there are many cases where the cognitive theory has failed adequately account for certain aspects of human behavior and cognition, particularly in complex situations. The lack of empirical support for the cognitive theory highlights the ongoing debates within the field of psychology about the legitimacy and validity of theoretical construct. While theory is undoubtedly important for guiding empirical research and developing new knowledge, there is a need for more rigorous empirical testing of theories to establish their validity and utility. In the case of cognitive theory, further empirical research may be necessary to establish the theory's validity to clarify its limitation. This research may help to refine the theory and develop more comprehensive models of human behavior and cognition that can be better account for the complexity and diversity of human behavior. In conclusion, while the cognitive theory remains an important framework for understanding human behavior and cognition, it is important to recognize the ongoing debates about its empirical supports and to continue to test and refine the theory through rigorous empirical research.
3, 2, 1.
Assalamualaikum and good evening. I'm Diodres bin Zamrudin and I'll be presenting a strength and a weakness of cognitive theory. Firstly, a strength. Cognitive theory is able to focus on how we emotionally react to things. In life, there are mainly two ways someone will think about a situation, either be logically or emotionally. Fundamentally, humans are creatures that are greatly motivated by emotions. This, however, must not be seen as a sin, but rather the natural state of our minds. We need to put more importance in how our brain perceives and interprets the happenings of our life. Understanding that emotions come first in many situations is the first big step that we can take in understanding the psychology of the human mind. Once we're able to grasp this concept, understanding our own thoughts becomes much more simpler and we're able to truly reflect upon ourselves. For weakness, there is the denial of the past. Cognitive theory can cause the person to forget their past, in a sense. If used improperly, it can involve a denial of the past where the person denies all the negativity that has happened to them. This can make it difficult for someone to move for the past if acknowledgement is not given to it. It is essential that we recall all that we've gone through, as our lives are made of our experiences and what we make of them. To ignore it is to fundamentally ignore all that you've done in your life and all that is part of your living experience. It may bring a sense of comfort, but it won't aid in achieving any new understandings or forming concise conclusions in your mind.
To conclude our presentation, this assignment has benefited us with so many knowledge. By doing research, history of the cognitive theory, theoretical assumptions, techniques or skills used in the theory, application of theory to resolve clients' problems, and criticism give us so many knowledge. We know that this knowledge will benefit us as a teacher in the future. That's all from us. Thank you.